If you think you're pregnant, you should probably go and get a pregnancy test at the supermarket or the chemist. The pregnancy tests are pretty accurate. They're about 97% accurate. So if it shows that it's positive that you're pregnant, then you probably are. Alternatively, you can come and see one of us at the health services and we will organise the testing for you here, either a urine test or a blood test, and we'll guide you as to what to do next. Every woman feels morning sickness differently. Some women have no morning sickness at all, and other women feel sick all the time. Morning sickness is worse when you're hungry, tired, or thirsty. So make sure that you drink regularly, eat small meals regularly, and rest when your body's asking for it. Every pregnancy is different. Every woman has a different reaction to her pregnancy. Some women can continue their studies and other women have to stop because of various complications. We treat it on an individual basis. To make an appointment with one of the doctors at the health service, you can ring up and speak to the receptionist, go online and follow the prompts on Hot Docs, or come in and the receptionist will help you out as well. If you're not sure of what your options are, please come and talk to us. There are options for termination of pregnancies in Australia, both medical and surgical. It depends on how far along you are, and all of these questions can be answered by any of the doctors at the health service. In Australia, you have several options for pregnancy. It depends on your level of insurance and whether you're an international student or a local student. If you're a local student, as in you have a Medicare card, you're eligible to be taken care of in one of the public hospitals that does pregnancy and maternity care. If you have private health insurance, you can choose to go through the private system. The obstetricians like to see you as soon as possible, so we want to see you to refer you as quickly as we can. Whenever you come to see the doctor while you're pregnant, you will have your blood pressure taken, your stomach examined. If the pregnancy is big enough and we can find a heartbeat during the examination, we will do that as well. That generally happens after 20 weeks. Sometimes we will order tests, and every time we will answer your questions. There are several tests you need to do throughout your pregnancy. Sometimes it'll be a blood test, sometimes it'll be a urine test, and sometimes it'll be an ultrasound. Generally, through your pregnancy, you'll have about 2 to 3 ultrasounds, sometimes more, and about 2 to 3 blood tests. In Australia, we take confidentiality very seriously. We only share medical information with other health professionals on a needs basis. If I do any tests and the hospital or your specialist needs to know the results, they will get the results, but nobody else has access to your notes or any conversations that we have during our appointment. So we're GPs, we are trained in family medicine. I have done extra training in maternity care, so every year I have to do extra training to fulfill these shared care requirements. We don't have obstetricians on site. We will refer you to an obstetrician who is a specialist in looking after women during their pregnancy. Once your baby is born, you will be referred back to the GP, so it's a good idea to come and see us so that you know where we are. So the University Health Service is here to provide care for students and staff on campus. We're conveniently located on all campuses and we provide a wide range of services.